Do you have a script that you talk to patients about when starting immunosuppression and kind of risk of cancer overall?
We start the script at the very first evaluation visit because it's important for patients to understand when going into transplant both the risks and the benefits. Overall, on average, people live longer and better with a transplant compared to staying on dialysis, despite the increased risk of cancer and infection with the immunosuppression. So that's number one. We try not to scare people away by saying, well, you'll get a kidney, but you'll die of cancer in 5 years. A lot of people would say, no, no, I'm doing fine on dialysis. I don't want that. The other thing is that it's immune suppression related cancers. So it's not cancers across the board that go up. So what I tend to tell patients is I introduce the concept of immune suppression. And I literally say it the same way every single time. I say, unless you have an identical twin, which so far I haven't heard that you had, the kidney comes from somebody who is enough genetically unlike you that your body treats that tissue as if it's an infection. And your immune system, which is geared up to fight infections, will actually attack the kidney unless we give you specific medications to lower your body's immune system. These medications are called immune suppressives, and you have to take them for the life of the transplant. It's not like once the transplant's working, you can stop the meds. Your body never forgets. The immune suppression does a really good job at protecting your new kidney from being attacked by the immune system, but it also decreases the immune system's other important functions, which is fighting infections and certain kinds of cancers. So the kinds of cancers which really start to go up in transplant patients above and beyond just the normal risk of cancer in everybody, those are cancers like skin cancers and a rare cancer of the lymph node system called lymphoma. Those two go up a lot, and cancers related to infections like papillomavirus or herpes viruses. So we encourage you, because skin cancer is so common after transplant, even from now, even before you have a transplant, stop burning, stop tanning. You can go out in the sun as long as you're protected. And if you find you've got a tan line, you haven't put on enough sunblock, you need to put more on. So we really start the education process, no matter what the person's skin color is. And that's very important.